Distinguished professors, distinguished participants, hi. Professor Kutay sent his apologies for not being able to participate in this Congress, so I will be presenting it. Before I start the presentation, I would like to give you some introduction. As you all know, the changes in pharmacy practice, when we have a look at them, in 1910, only pharmacists used to work in manufacturing. In 50s, they started to work in dispensing, and along with the advancement of the science and with the contribution of technology, they are now active in pharmaceutical care. After 80s, this has been there since 1980s. It started in the United States, then it became a reality in many places in Europe, and today in Turkey, since 2014, it's a separate department, clinical pharmacy, and like TUS, expertise in medicine, now there is an exam called as expertise in pharmacy. After that exam, they serve in different hospitals, and in the multidisciplinary team, there are also clinical pharmacists. When we look at the definition of clinical pharmacy, we can say that a health science discipline in which pharmacists provide patient care that optimizes medication therapy and promotes health, wellness, and disease prevention. This is the definition of American College of Clinical Pharmacy, and they also develop and promote rational and appropriate use of medicinal products and devices. And this is the definition of European Society of Clinical Pharmacy, ESCP. And the clinical word is representing the activities for the health of the patient, not because it's conducted in the clinic. How is the situation in Hacettepe University? Professor Dr. Kutay Demirkan received education of 7 years in Tennessee University. He came to Turkey, and in 2001 he started to work in internal diseases ICU, and then he participated in nutrition team, and afterward Associate Professor Algin Ekincioğlu, he came from Scotland after the completion of his education, and then they started to work in neurology intensive care unit and pain management team. Clinical pharmacy service, how is it being done in Hacettepe? There are daily morning rounds, and during those rounds, if there are problems related to drugs, the pharmacists give their opinion in that regard. Or there is a call service. We do have phones. It's called as on-call service in Hacettepe. About, for example, there is a department about that, using drugs during pregnancy or lactation. We give consultancy services in that regard. Three professors you see in the middle, it started with 3 of them, but now we are a big team. And when we look at where they work, in general medicine, medical intensive care unit, nutrition team, neurology intensive care unit, oncology, geriatrics, infectious diseases, pediatric intensive, algology and nephrology. So what are the responsibilities of a clinical pharmacist? he or she should select the correct drug, proper dosage, and appropriate route of administration, because some drugs, as you all know, cannot be broken, and there might be sometimes we need to help the nurses mostly. And if they're XLSR, if there's such an abbreviation, this drug is providing controlled secretion, therefore you can't touch the drug. You can't divide it into two, for example. A patient was consulted to me when I was in psychiatry department. Colonosea, this patient has colonosea, operated, hemicolectomy and colostomy pack was put, and while the patient was using depekine, that within colostomia pack, the drug is there untouched, and they look at the blood values. There was no problem, and they asked me my opinion, and the formulation has a spongy structure. It's acetylcellulose and valproic acid, and it gives slow secretion. It's normal to see that. Therefore, I explained them, and they continued the drug therapy afterwards. This might be an example. And we can also choose and time the specimens for therapeutic drug monitoring, and we also interpret the pharmacokinetics effects of the drugs. Drug interactions, these are biggest challenges of ours. Adverse drug effects and toxicity are the other two topics. Let me talk about Voltaire. A physician is one who pours drugs of which he knows little into a body of which he knows less. There might be an increase in the problems resulting from the drugs. World Health Organization has an announcement about the rational use of medicine. Patients receive medications appropriately to their clinical needs in doses that meet their own individual requirements and for an adequate period of time and at the lowest cost to them and their community. It should be cost effective. While we are using minimum dose, this you can see in this caricature, contraceptive. While you are trying to limit the cost, you need to be also considering the efficiency of the drug. And what about irrational use of medicine? It's a major global problem. This is what the World Health Organization says. And more than half of all medicines that are prescribed or dispensed or sold inappropriately, and that half of all patients fail to take them correctly. The overuse, underuse or misuse of medicines result in contamination in the wastewater. And examples of irrational use of medicines might include polypharmacy. It's one of the biggest challenges. Or overuse of injections when oral formulations would be more appropriate. And there might be failures to prescribe in accordance with clinical guidelines, or inappropriate self-medication, often of prescription-only medicines, especially in psychiatric patients. If they don't comply with the prescription, then the treatment is going to fail. And inappropriate use of antimicrobials, often in inadequate dosage for non-bacterial infections. All around the world, Turkey is in the list on top in the list in antibiotic resistance. When we look at the requirements of a clinical pharmacist, what should they have? They should have an extensive knowledge of therapeutics and medical terminology. He should have a good understanding of disease and drug monitoring processes. He should have therapeutic planning skills. He should be able to assess and interpret physical and laboratory findings. And he should be able to provide information about the drugs to the physician and also to the patient. What about drug-related problems? In the definition, we can say that it's an event or circumstance involving drug therapy that actually or potentially interferes with desired health outcomes. There might be actual problems, a drug-related rash, for example. The patient uses it and there is a side effect as rash, and then you discontinue the drug, or you can add additional drug to prevent rash. And there is also potential problem, administration of ciprofloxacin to a patient taking theophylline. In such situations, ciprofloxacin can increase the blood concentration. Therefore, you need to be careful about the blood level, and you should prevent it to reach a toxic level. Drug-related problems, we need to choose appropriate drug, first pharmaceutical group, and then itself. Drug dosage is very important, monitoring adverse drug reactions, and drug effects should be followed well, toxicity as well, adherence problems, and also drug interactions. Here, when two different drugs are used simultaneously, there might be very, very different results. Although drug-related problems are important, most of them should be managed well. JAMA, for example, in 1999 published a study results. Pharmacist participation on physician rounds and adverse drug events in the intensive care unit. With the recommendations of the pharmacists, 66% of decrease in adverse effects was observed. In Archives Internal, now JAMA Internal Medicine, in that as well, there was a similar result, 87% decrease in the drug-related adverse effect if there is a pharmacist within the team. Apart from that, Adilvirane and Natalie Crown published in Canadian Journal in 2005 for the pharmacist initiated 48 interventions during the 4-week period, 47 of which were accepted by the treating physician, and 86% of the interventions were assessed as having a positive effect on patient care. And drug cost per patient day was 14% lower in the year after the implementation of the pharmacy position, and this is the financial effect, positive effect. It becomes cost effective, and $5,485 saving. In the Journal of Clinical Psychopharmacology, there was a publication in 2019. There's self-criticism editorial published by Leon. And what is the perspective of the physicians to drug interactions? Why is it being neglected? This is a self-criticism. And as a result, the physicians older than 50 years, they were not trained in Stockholm P450 science in medical school. Therefore, they neglect these drug interactions. And apart from that, we can give many other examples of studies which show us the contribution of the pharmacists In summary, clinical pharmacy practices in CAMH and psychiatry, they can prevent adverse drug events. About drug interactions, it can control the interactions, and it might enhance adherence strategies. It can prevent polypharmacy, and they can monitor therapeutic drug, and it can also fall risk assessment. There might be drug education within a multidisciplinary team, and drug administration, neuroleptic Malin syndrome patient, for example, NG is put, and how is it going to be administrated? Or Alzheimer patient, 85 years old, this patient, how are we gonna administrate that drug? Because he has a hardship of swallow, but of course this is evidence-based medicine, and with the literature on our hands, we go to the physicians and we make our recommendations. William Osler has an important saying: the person who takes medicine must recover twice, once from the disease and once from the medicine. And we need to have a multidisciplinary team, and everybody should provide patient specific service. That is the biggest advantage. Thank you very much for your attention.